So then we talked a little bit about background. We've spent some time with communicating with individuals with mental illness, really thinking about the challenges from a disparity perspective, some of the challenges from a symptom burden perspective. How do you engage in effective communication? And a lot of it are very common principles, regardless of if someone's experiencing mental health symptoms or not. It's super important to actively listen and provide validation. Validation can be really important in fostering a sense of, safety, a sense of establishment of rapport with the person that you're talking to. So using terms like, it sounds like you're experiencing this, or it makes sense that you're feeling this way, and really trying to show that individual that you are there for them, you are listening to what they're saying, and you're offering that affirmation of, hey, I'm hearing you, right? I would recommend avoiding saying things like, I understand how you feel, because in people who might be really irritable or have experienced really different experiences than you, that can sometimes even feel invalidating because you can't truly understand what someone's feeling. It also, this can be challenging, but it's also really important to realize that the negative behaviors that you might notice could be really kind of from something that was out of your control, right? They could have painful or traumatic or triggering memories that happened, and their behaviors are in response to that experience. So sometimes it's helpful to be informed about their previous experiences or what things they know have been challenging for them in the past, like talking about something more openly in a hallway versus really trying to be private about discussions. Or there are certain questions that can be more difficult to answer. So assessing for some of those similar experiences or challenges that you can anticipate and be proactive about that. I think it's really important as well to try to communicate at that person's level and sort of match their vibe, if you will, being straightforward and expressing concern and, holding that space for that person versus trying to be this like expert authority, talking to a victim themselves. That can feel really belittling, and that can really make people feel smaller and less empowered. And it is important a lot of times, especially if we're thinking about someone who's experienced something traumatic, it's important for them to feel like they have some autonomy and have some power and aren't being always treated in a way that they are less than, right? And I think this is really important too, is choosing your words somewhat wisely. We all make mistakes. There's no perfect way to communication or to communicate. See, I just messed up there. there's no perfect way to communicate, but avoiding certain terms that can be stigmatizing, even if it's something that you see colloquially, you see often outside of these types of communications that are just kind of part of day-to-day language. And I'm going to give some examples here. So choosing your words. A lot of times I try to avoid using the word abuse. There are some places where it is appropriate to use, but I'll try to say use or misuse, because in a lot of situations, abuse has this really negative connotation to it. Addict, we also tend to try to avoid because it's a label that we might use in a way that has a societally negative association with it. Some people will refer to themselves as addicts, and if that is their authentic and comfortable space with which they want to speak about themselves, that's totally fine. I wouldn't correct someone who refers to themselves as an addict, but it's not our space to label that person that way. So we refer to them as this person who has a substance use disorder, they have alcohol use disorder, etc. I also encourage to avoid saying things like clean or dirty, because that refers to it. in a different way, right? It has this negativity associated with, if you use a substance, you're dirty, right? So typically what we'll use is the word sober, or in recovery, or in remission from their substance use disorder. If we're referring to a test like a urine drug screen, for example, we would say positive or negative, not their urine drug screen was dirty, right? Or it was clean. And I hate the word normal. And it seems weird to hate that word, but it's this context, right? So if you say like, well, you just seem so normal, that makes it sound like what they are experiencing or what their diagnoses are so bad, or, abnormal, in the sense of like, oh, what's wrong with me, sort of thing. So we usually use the terms neurotypical, neurodivergent, right? Baseline sometimes, if someone has a baseline that we're trying to help them recover to. But saying like, oh, this person seems so normal can be harmful in a lot of ways. The word crazy, although you see it all the time, you hear it all the time, the amount of times that I've had, patients really struggle with that word, in the sense of like, well, I don't want to be labeled as crazy. I'm not crazy, sort of thing. I think it's really important that we realize those types of words have a lot of weight to them, and try to avoid using them in casual conversation if possible. I usually try to say, oh my gosh, that's so wild, or, that's laughable, that's just silly, sort of thing, instead of saying crazy. We also see a lot of reference to specific conditions that really minimize potentially the actual significant, in some way, in some senses, in some situations, negative impact, the potentially really disabling aspects. Not everyone is, but a lot of people may experience a really big loss of quality of life if they have a diagnosis of obsessive compulsive disorder or attention deficit hyperactivity disorder. And of course, all of this is on a spectrum, so that's not always the case. But casually, you're describing your meticulousness about getting ready for the day, or your distractibility for that day is, oh, I'm so ADD today. It really can be minimizing to people with that lived experience. And of course, we have the R word, which was historically a medical term that people had commandeered to be, insulting to other individuals. So usually what we'll use for that term, if it's someone who experiences it, is a developmental disability or developmental delay, because the R word, frankly, just has become so insulting for individuals today. And then you will see a lot of suicidal humor that comes around, like, oh, I'm just gonna kill myself, sort of thing. And it's difficult, because negative humor, self-deprecating humor, can sometimes be a good general coping skill or communication for people. But when it comes to the potential implication of joking about that kind of stuff, it can cause a lot of discomfort for people who might actually seriously be thinking about harming themselves, or, considering suicide. So being really thoughtful about that. And finally, some more general tips. Making analogies can be really helpful. People often separate mental health conditions from physical health conditions when the brain is an organ. So I like to remind people of that. Sure, it's the organ that makes us feel and think and all of those types of things, but it's still, at the end of the day, an organ, right? So diabetes is a huge spectrum of potential, level of difficulty in management and types of diabetes. And we don't shame people who need to be on insulin and, pills and 3 or 4 medications to manage their diabetes, when we compare it with someone who might be able to make some lifestyle changes to help manage their diabetes, and that's all they really needed. Yet we will shame people when they require medication to help treat their disabling depression. So really trying to think about those analogies of, hey, I know it's a little bit different, but truly at the end of the day, it is a condition from your body, right? And I talk about analogies like sailing a boat on the ocean. We have to make small changes. We can't turn boats really fast. You have to have some patience when it comes to treatment. And, everyone's boat's a different size. Everyone's sailing on a slightly different ocean. Really thinking about that level of understanding and validation of the individual. It's also really important to understand your own limitations and level of comfort. So people in healthcare, and other people too, but in particular people in healthcare, if they're consistently exposed to traumatic information, to lots of crisis level mental health concerns and symptoms and environments, then you can potentially experience what we call a secondary trauma and experience your own level of burnout. And it's really important to have a source of comfort, a source of release, a source of a trusted coworker to debrief or professionally vent to, so that you take care of yourself as well. So a lot of times we want to pour our hearts out for people and walk across, the coals for them. But it's very, very important to take care of yourself and understand when you've hit a point where, okay, continuing this communication, continuing this scenario is really not helpful for me right now. I need that space. I need that time. And don't be afraid to ask individuals about how they're feeling specifically. A lot of people have misconceptions or have discomfort when it comes to asking others about suicidality and self-harm. But the best way to ask someone if they are thinking about suicide or if they've thought about ending their own lives is to ask, and ask directly. So asking in a way that is, have you been thinking about this? Is this something that you've been considering? Have you thought about taking your own life? Instead of, oh, you're not going to kill yourself, are you? Those types of communications sound more accusatory versus, have you thought about this? Right? Suicide is often a solution to a number of different problems. It's not a problem in and of itself. It's the thing that someone might come to as a conclusion to help end suffering or help end their situation or improve their situation. It's not specifically a problem itself, if that makes sense. And there are resources available that should be engaged immediately if the answer is anything but a direct and confident no. So things like the Suicide and Crisis Hotline, for example, are really good to have in your disposal in those types of scenarios.